Alright guys, so moving on. Sorry, I just had to take a pause because nagsingot-singot na ko. Sorry. So let's move on. So we're done with chief complaints. Then present health status. So we'll be moving on to past health history. So doing your assessments of past health history, ang mga relative questions nga pwede mo ipangutana sa imong patients by this time are, say for example, immunization. Okay? Past health history. Past health history. Okay, so vaccines. Immunization or immunization. Okay, what else in your past health history? Accidents and traumatic injuries. Traumatic injuries. Isa pa, pwede na ito i-ask diha. Hospitalization, surgeries, chronic and mental illnesses. Okay. So, narata sa past health history. So, I'm going to give you an example on how you can ask that to your patients. So, ma'am, sir, may buntag. So, ningon man ka ganyan, no? Past chief complaints ta. So, ma'am, ningon man ka nga sakit imong ulo, sakit imong tiyan for almost 2 days na. Okay, thank you so much for informing me. That's salamat sa pagpa-inform mo sa kuha na. So, diretso ka sa present health status, PQRST. Okay, after PQRST, so ma'am, gamay ng pangutana ma'am. So, nalang kay pangutana, nakasulay na admit? Sure, have you been hospitalized just once or twice or before? Or nakasulay naka traumatic accidents or traumatic injuries and accidents? Isa pa, kumusta ma'am? Guys, if patient ninyo bata, please ask this. Or patient ninyo from 0, let's say 1 month to 17-year-old, which is encompassed with our pediatric age range. So pedya gani from age 1 month to age 17 years old, okay? Moingon gani or pedya gani yung patients, you can ask, sir, ma'am, kumpleto siya bakuna? Unsa na yung mga bakuna yung nadawat so far? Okay, so that's going to be how you ask for immunization or how you ask for vaccines. Now, for our elderly patients, it is very important you ask, ma'am, sir, walay history sa diabetes. Ma'am, sir, walay mga gimintain nga tambal. Sir, walay mga chronic illnesses for sides of the family. So, maapila po na itong family history niya. And for immunization sa tigulang, so, kita karon yung mga generation, it's different from those who were born in the those who were born in the 40s, 50s, and 60s. Again, polio vaccine was just invented on late 1970s. So, it would be different. It would really matter if you're going to ask your patients unsa ilang vaccine nakuha na sa pagpanganak nila. Kaya nga naman, katong nga mga panahon ng anak sa 1940s, 50s, 60s, or 70s, pwede pa ang late 70s tingali, wala pa na sa polio vaccines on those time. So you can ask them if natagaan na sila polio vaccine booster dose. Okay, for elderly patients. Okay, so parts of present health status you need to ask, again, childhood illnesses sa mga pedia patients. Pwede niyo din siya pangutana sa mga younger aged patients. So for example, 20 to 30 years old, pwede sa ninyo ni siya ipangutana, ma'am, sir, unsa na yung mga vaccines inyong nadawat. Now, accidents and traumatic injuries. You can ask this, especially sa mga bata age 1 to 3-year-old, which are very, very kulit and which are very, very playful. So, common sa ilaha ang false. F-A-L-S, false. Nangahulog sa kuna, nahulog sa duyan, nahulog sa hagdanan, nahulog sa panapantawan. So, those are very common accidents for toddlers age 1 to 3 years old or even 1 to 5 years old. So, again, muna siyang accidents and traumatic injuries. Alright? So, past health history again. So, nato rin hospitalization. So, istorya na ko na ninyo if patient ninyo has been hospitalized or nasulay na ba sila admit. So, you can ask them. Now, if nakasulay sila admit class, you can just simply ask, sir, unsay diagnosis sa doktor ni mo atong tanong na? If they know, if not, pwede na po, ayaw po mo pamugos. You can also ask, sir, nakasulay ka na abunuhan ng dugo atong time during SEM admission? Or, sir, undergo ba ka atong surgery nga time pag-admit nimo? Alright, so that would answer again surgeries on page 10 on your module 1. Okay, now psychiatric and mental illness, please be careful when asking this one because a lot of patients or a lot of your patients would be very, very particular on how you ask them. Some are culturally sensitive to this question or either religionally sensitive to this question. So you can simply ask, ma'am, sir, walay kaliwat nga na ay pangulang sa pangutok or mentally incapable or mentally unstable. Ana lang, then do not ask, ayaw na i-probe pa, ayaw na i-depend pa ng question diha. Again, some people are very sensitive to this area sa inyong interview. Alright, now allergies. Let's move on to allergies. Ma'am, sir, wala kay allergy sa pagkaon? Pagkaon, tambal, o imnunon? Alright, you should ask those 3. Sir, wala pag-allergy sa pagkaon sa pa? Nuts, peanuts, peanut butter, those which are hypersensitive or not non-hypoallergenic foods. Unsa pa? Chocolates, milk. Okay, daghang patient or there are patients out there who are lactose intolerant. Okay? Katong mga dili makatolerate og milk or dairy content sa pagkaon. Okay? So say for example, ice cream. May mga taong allergic sa ice cream. Why? Because ice cream has milk in it. When there's milk, there's dairy product or that's a dairy product. What else? Nuts. Peanuts, cashew nuts. At pa naman kasi mga nuts diha kanyang chirya nga na yung mga nuts. So some patients are allergic to those. Imnunon. There are patients na allergic sa beer or liquor or alcoholic drinks. Okay? Na ay wala po tingali tao na allergic sa tubig. But there are patients who are allergic to some or specific drinks. Dili siya allergic sa tibok drinks. It's just that na ay component or ingredient ana nga drink which makes him allergic or hypersensitive to it. Alright? So, family history. Ma'am, sir, walay kaliwat. Sa side sa imong papa, sa side sa imong mama, unsay mga sakit usually nila? Sa side pa sa imong papa, walay diabetic, walay walay heblaron, walay na cancer, walay na mental illness. So you can ask those. Sa side sa mama as well, if they are younger patients. If elderly patients, of course, dili na siya kinahanglan i-ask, kaya usually, mugawas na sa ilahang it's predominant na, meaning kung sa sakit sila magginikanan sa edad nila nga karon, elderly na siya, usually nanggawas na itong mga sakitan. It's a common problem or a common complaint na para sa ilaha. Right now, medication. You can simply ask for younger patients aged 0 to 17. Let's go back for pedia patients. For pedia patients, you can simply ask, ma'am, sir, ano say vitamins nga gitake sa bata? Or wala na siya ginainom ang tambal lately? You can ask that. Or wala na siya laing mga supplements na ginainom, mga herbal, at sa panadya, ma'am, sir? So, wala. So, elderly. Let's ask elderly. Ma'am, sir, kasi guys, sa edad sa mga tigulang or sa edad sa mga elderly na to karon, they usually have maintenance na. Maintenance for their high blood, maintenance for their diabetes, some even have maintenance for maintenance meds for cancer. So we might not know. So pwede ito ni-ask sa mga elderly patients, especially maintenance guys. Kaya ano man, we have to take note of that before submitting the assessment forms to our RODs or resident or duties or simply our doctors in the hospital. Okay. Now medications, i-connect na tong allergies. Ma'am, sir, makatumar sa unsa nga tambal, walay mga allergies sa paracetamol, sa mefenamic or unsa pa, wala nakasulay og pangatol nga nakainom og mga antibiotics. So, pwede nimo i-connect ang medication or allergies. Alright? Perfect. So, that's gonna be end. Pas kay ko. Okay, this is just a review. Okay, so that's the end for our module. OMG, that was module 2. Same title, guys. So, balik na, module 1. Okay. Okay, module 1. Okay, so what are our 4 types of population groups na we can assess or that are included as a special group for a special assessment or for health assessment? Again, we have pregnant patients, infants, child, and elderly. Okay? So kana sila ang common nga yung mga sakit. So as you can see, wala diha ang mga middle age like 30 or 25 to 45 or 25 to 50. So usually wala diha na nga mga age group. Why? Because their immune system is still at peak at that time. So dili pa kay sila masudlan o makabati og mga sakit-sakit ana nga mga time. Age 1 to 17, again guys, ang immune system sa bata will take effectivity when they're already 12, usually 7, 8 years old. So wala pa kay na immune system mga tong mga bagong panganak, munang they need to be taken care of. Elderly, tigulang naman, mubo na ang immune system nila, so dali na sila masakit. And again, predominant or precipitating factor, say for example, yung mama at papa niya ito na yung mga sakit sa kidney, cancer, or na yung mga problema sa halang blood sugar. Usually, if nagtigulang na ka, predominant na po na siya, mutukar po na siya sa inyo ha. That's why elderly population are at risk and should be interviewed correctly. Okay? Alright, so let's move on. So parts atong physical, parts atong health assessment, guys, is our head to toe examination, or what we call physical examination. Okay, but we'll be talking more on that on your following modules. Okay, so physical assessment, guys, we have 4 techniques in doing physical assessment. 1, inspection. Unsaon pag inspection, sir? Use your sense of seeing. Use your sense of smell, taste. Yan na. Hearing, isa pa, feeling or touch. Okay, nasulod ang pasyente. Ala, namula ang naong baho o alcohol. So, that's already inspection. So, without asking your patients kung naunsa siya, you can definitely inspect bisag layo pa siya just by looking at him or sa smell nga iyang gi-emit. Why? Chismosa ni nga kaning technique nga inspection, this being you as a chismosa person. Okay, gets? Inspection, again, that's going to be using your senses. Ayaw tila yung pasyente. You will not like it. Okay, next, after inspection, let's proceed to auscultation. Guys, doing auscultation, you would need a stethoscope. So that's going to be the material you will be needing for auscultation. Auscultation is using a stethoscope, listening to area. Okay, dire, which are filled with air, or just simply wanting to hear imong abdominal sounds. Okay? Ang tumoy sa ato ang stethoscope, guys, natay duha ang bell katong dako nga lingin sa tumoy sa stethoscope. Sa luyuan na niya mo sa atong dako, which is our diaphragm di ay. Ang luyo pa katong gamay, which is our bell. Okay, so nag-send ako ninyo og pictures of parts of a stethoscope. Okay. Auscultation is performed following inspection. Now guys, auscultation, guys, is performed out following inspection. Okay, do not forget ang pattern or ang sequencing. Auscultation should not be performed over a person's clothing. It should be skin to skin ang inyong diaphragm. Okay? So, dili pwede mag-stethoscope anak dire. Okay? Muna siya ang ideal. Makakita mong doctor sa hospital nga mag-stethoscope nga naa diri sa sanina. That's not ideal, pero bisog high-tech na to lang gigamit ng stethoscope kay madunggan man gihapon. But the ideal thing is diaphragm of your stethoscope to skin. That's how you hear, you perform auscultation. Okay? Next, palpation. That's going to be using your hands from the word palpate, palm. That's going to be by the use of your hands. You palpate your patient's skin for temperature. Sa pa, moisture. Sa pa, pulsation. You use palpation when you take pulses or pulse rate. Okay? This is going to be a radial pulse, brachial pulse, carotid, temporal, inguinal pulse, natad dire ni pulse o dire atong talocrural pulse. Okay? What else? Palpation. Okay, percussion. Let's proceed to percussion. Review na lang galing ni. Okay? Percussion, guys, that's going to be using your using a percussion hammer or cupping your hands. Percussion. So see? Hollow sound. Okay, why? this is full of air because my chest is here. This is your rib cage. Using rib cage is your lungs. So that's how you percuss. Pwede po mo gamit itong percussion hammer, which can be to detect reflexes for a percussion hammer. Okay, by the way guys, when inspecting the abdominal area, dapat una ang auscultation before sa percussion. Why? It would be, or you would be getting a different sound if unahon ninyo percuss ang abdominal area before muna auscultate. Again, una ang auscultation, abdominal area before percussion. But those four can be used interchangeably, or that can be used when you will be doing physical examination. Okay, so now let's move on. Okay guys, critical observation in health assessment is also known as pagiging chismosa or critical observation. And so that's gonna be inspection. All right. Okay. See here. Okay, so what's gonna be a technique? What's gonna be a procedure that give me 1 second. Okay, a procedure to prevent the possibility of contamination of the operative wound. Surgical hand washing. Okay. So guys, basaha or tunis na tunin yung mga abbreviations. So for example, to CBG, capillary blood sugar, or CBG, capillary blood glucose rather. Isa pa ROD, that's resident on duty. Itong letter C nga gamay, that's gonna be with. Letter S, that's gonna be without. Q nga gamay, that's gonna be every. So those are medical abbreviation or symbols that you need to review or you need to study for you to answer your prelim examination. Okay, let's move on. Okay. Now guys, not tayo tulo. When you're assessing your patient's skin, you would definitely note different types of pigmentation or discoloration of your patient's skin. Now, if namula-mula ang patient's skin mo during physical assessment, you can note that as, again, nagpula-pula, you can note that as erythema. That's how you describe it medically. If nag-yellow, murag hepa, that's gonna be jaundice. If nang loose spot, that's gonna be pallor, P-A-L-L-O-R. If nag-blue na, halos na siya mo violet, that's gonna be cyanotic. Okay? That's gonna be cyanosis. Or how you describe skin pigmentation during physical assessment. Okay, so guys, review. There's gonna be 12 cranial nerves. So wala pa rin natin i-discuss officially. But just a review. This might or might not go out of your examination. But again, please review online on cranial nerves, specifically on cranial nerve 1, cranial nerve 2, cranial nerve 3, cranial nerve 4, and cranial nerve 5. Cranial nerve 1, that's going to be olfactory. That's going to be the cranial nerve responsible for your sense of smell or sense of smelling. Okay? Cranial nerve number 2, that's going to be your optic nerve, which is responsible for your vision. Well, this is responsible for reflecting and interpreting whatever you see out there. Okay? Cranial nerve 2, that's optic. Cranial nerve 3, 4, and 5, that's going to be oculomotor. That's going to be your trochlear and abducens. Oculomotor, your nerve 3, cranial nerve 3 is a nerve responsible for moving your eyeballs from up, down, left, and right. Trochlear, that's a cranial nerve responsible for again your sinuses, your nose as well. talking, but again, cranial nerve number 1 is the one most responsible for your sense of smell. Trigeminal, this is gonna be your cranial nerve 4, and then cranial nerve 7. Please take note, that's gonna be your facial nerves, responsible for making you smile, making you grin, making you sad, making you look ugly, whatever. Okay, that's cranial nerve 7, responsible for facial expression. Okay. So let me see here. Okay guys, please also when you study health assessment, please take note na kung why is health assessment or doing health assessment important to you as a midwifery student, okay? And also you should ask yourself, ano importante mang health assessment sa midwifery student kung wala pa mong graduating hospital? You should ask yourself that question as early as now, okay? And then, so we talked about communication in CP, Module 3 in CP or in mid. That's going to be therapeutic communication. So, correlate mo while doing the interview for your patients. Why is communication important during health assessment? Ano important man ang good communication, ano important man ang therapeutic communication when talking to your patients. Okay? And please study gloving, hand washing procedure because that will come out of your examination. Okay guys, think I've touched all important details for your prelim examination. Again, I'm going fast because this is just a review. If you have time, for those who cannot go on online, please go on online even just an hour or 2 in a day for you to review the audio lecture or discussions I've sent on your GCs, because that's going to be very important, especially for CP 100 and mid 100. Alright, so that's going to be all for today. Block A, B, C, and D. This is your Al-Phi. Goodbye.